Hi everyone, I'm Carol and welcome to today's Pilates for Beginner with back pain video. Link my video here, but I detail my journey with chronic lower back pain. So just know I am empathizing with you if you are doing this workout because you're experiencing back pain. Remember, I'm not a doctor. Please seek out medical advice from the appropriate resources and do not do anything that causes too much pain. Let's get started. So the first thing I like to begin with is a Pilates ball. However, you can use a slightly deflated basketball, soccer ball, your kid's Nerf ball, or if you have a foam roller. Basically just anything that will roll along the surface, even a balloon. I'm doing this on the floor on a yoga mat. You can do this on a table, on your bed, on the floor, of course, on your sofa. I actually purchased a massage table when I was at the height of my back pain journey because I could not get on and off the floor comfortably. So keep that in mind. Also, if you think you're gonna have trouble getting off the floor, bring a chair close by. That way you can help balance you and help you get up. But for now, let's just get started. So rolling back, on our back, we're gonna put the ball under our foot and we're gonna start with really simple rollouts. So I'm gonna take a second here just to sink into the ground. Sometimes when my back was hurting, I would have this like sizzling feeling almost. Give yourself that moment that you need to adjust to this new position, and then we're going to hold our abs in, hold our ribs in, and start pushing the ball out with our heel. So we're gonna do this 8 times. 1, 2, 3, 4, and do this at a pace that you can comfortably control the ball and keep your abs engaged. It doesn't have to be fast, it doesn't have to be slow, it's literally whatever you want it to be. So hopefully that's 8. You'll learn quickly, I'm bad at counting. Now that we've done this rollout, we're going to extend our knee to the wall. So just like a one-legged butterfly. And again, we are thinking about engaging our core. And you'll start to feel the differences, especially when we switch sides, how there can be some changes between our left and right side. Most of us do have a dominant side or a side where we feel the most stable. And so sometimes it's also nice to start on the side that you know is slightly weaker. I'm gonna do 2 more. That just feels right. I'll get better at counting, I promise. Okay, now that we've done that, we're going to take our heel and we're gonna dig it into the ball and kind of press down again for 8. And this whole time, while the ball and the foot is what's kind of moving, what we're really focused on is this core and this area where we're wanting to get our stabilizers kind of back engaged. Awesome. We're gonna switch sides if you can. I just roll a ball under my foot and I get going. So again, we're gonna do 8, 7, 6, 5, 4. Do you feel the difference between your left and your right side? Just take note. It doesn't mean anything, good or bad. Even before I had any problems with my back, I was a dancer, and all dancers know they favor a side. I could whip out triple pirouettes, turning on my left foot, so turning to the right, in the right direction. But goodness, my left side was always a challenge. So just know it's normal. You're not weird. Or maybe you are, but it's a different kind of weird. All right, I'm gonna do 1 more. And now we're gonna press into the ball with our heel. I like to think toes up. Just helps me kind of keep that reminder that the weight needs to be in my heel. But again, the focus is on our trunk. Awesome. Good job. We don't need the ball anymore. If you can, put your legs in. This is called tabletop position. If this is hurting, something that might feel slightly better is to put something plush under your back, like rolling up a towel, maybe a yoga block. Because my pain was always in my lower back, having pressure off those discs felt good. And I don't feel like there's any harm in making movement feel good. So if you need to put something under here, even your hands, do it. But we're gonna put our legs up in the air, and we're gonna do, first we're gonna start with toe touches. So I like to alternate. Again, I'm bad at counting, so it keeps me even on both sides. So we're gonna do a total of 8 on each side. So I think we're at 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8. And you'll notice I really like to count up to 8. You can do 10, you can do 12, but I think for beginning, 8 is a great place to start. So now, this is why I call it dead bug. We have our legs in tabletop. We're gonna put our hands on our knee, and alternating knees, we're going to press in to the hand. I begin shaking. So if that's happening to you, it's happening to me too. And again. So again, all of these things we're doing is really about turning on our stabilizer muscles. We want our cores not only strong, but stable. And stability is something you lose when you lose cushion in your discs. Because discs are there partially for comfort, but also for structural support. So as that starts to go, thus our support does as well. So now that everything's turned on, I say, I'm warm, let's move on to a little bit more of like the exercise bit. All right, let's start with some ab work now. Now that everything's turned on, let's get it out of the way, okay? So back down on our mat. Let's begin with a little bit of a prep. I like to have my hands behind my head. I'm not pulling my head, it's just there for support. I think chin up, and I sort of guide my eyes to looking just at that seam of the ceiling, right? Okay, so we're gonna start with, what did you think? 8 crunches, let's do it. 1. 2. Good job. Now if you're ready, let's go put our legs back in tabletop. I'm gonna have both of my legs in tabletop, and I'm going to alternate one leg out at a time. If that is hurting your back, drop one leg to the ground. Have it there for support, and just do this. Good job. Now you're going to extend your hands over your head and just lifting up to where it feels comfortable. Bring your hands down and back up. Great job. If you can get to your side, now one way that I find I can move to my side pretty gently is by keeping my feet planted on the floor slightly curling my back, and then pushing my hips back to bring me over, sticking this leg out, and then pushing up this way. Now, if you're not in so much pain that you can just roll on over, great, good. But if you are in that phase where everything is tight and sore, be gentle. So now that we're up on our sides, I'm gonna plop one hand on the mat, maybe out a little bit further, stack my knees over top, extend this hand, and then we're going to curl slightly and back up for 8. Good job. And on this last one, I'm gonna bring my hand down to the mat and lower to my elbow. So resting on my hip, I'm going to bring my knee up and do some extensions. Again, if this is painful, don't do it. So now, kicking our knee through, we're going to tap front, boop, swing it back, boop, bring it forward, tap, swing it back, boop. I like to do this one pretty slow. Because the point of this movement is to still control. Now we'll just do some small leg circles. And reverse for 8. Awesome. I'm gonna switch sides. You can just roll over and face the other direction. Or again, if you're in a place where you're comfortable enough to push up, rock to the other side of your hips, and then repeat that process of pretty slowly and while having weight in your hands, extend yourself onto the mat. So hand on the mat, ankles stacked, knees over each other. We're gonna curl. Good job. Both hands on the mat, lower to your elbow, knee up, and we're gonna go in for 8, 7, 6, 5, 4, 3, 2, 1. Now forward, kick, back. Forward, kick, back. Forward, kick, back. Forward, kick, back. And if you're my dog, you'll start licking yourself. I'd kick her out of the room, but I don't want to. One more. Now leg circle to the front. to the back. Good job. So hopefully you felt a little bit of a burn in your tuchus, a little bit of burn in your abs. Let's move on to some mobility work, working through our spine just a little bit. Quick cool down and then we're done. So hands and knees in tabletop. So in tabletop you want to be as perpendicular to the ground as you can, and then we're going to do the classic cat-cow. I'll show you, but I bet you know what it is. So sucking in our belly button towards our spine. We're going to push through, dropping our belly button towards the floor, extend up. Let's do 4 of these. Good job. Pushing up onto our knees. Now I want to do a little bit of child's pose and just some extension. This is where you may have to play around with it to find a position that feels good for you. Sometimes I felt like a full child's pose was too aggressive and I would get that tingling sensation. So I recommend walking your hands out to where you feel comfortable. Pause. See if you can build into a stretch. Take a couple deep breaths. And then if you feel ready, keep going. If it's comfortable, walk your hands to the left of your mat or your bed or wherever you're doing this and extend. And then I like to drop the outer shoulder down to the floor. So sort of drop that to the floor, push back, and really get into that armpit. Walking to the other side. We'll repeat that. Since we're here, let's end things on a good note. Let's do a couple leg extensions, and then we can build into a Superman type of move if you're comfortable. So knee up, back, touch the ground, up, bring it in. So right now, we're again doing things for stability. But right now I'm very stable because I have a knee and both arms on the ground. So I've got 3 points connecting me. Again, you might notice some differences between each side. If you want to test yourself, but don't push yourself too hard, but if you want to test yourself, when we extend this left foot, let's also extend our right arm. And we can do these one at a time. Typically, you're going to see it done like this, but if that feels a little aggressive, let's do hand out, then our leg. Gives you a chance to sort of adjust to that two-legged stance instead of, or 2-point stance instead of the tripod. So leg out, then our arm, bring it in, leg out, then our arm, bring it in, leg out, our arm, bring it in, leg out, arm, bring it in. Push back to your knees. Give yourself a little bit of a stretch. If you can, lift your hands to the ceiling. Give yourself a little hug. And we're done. Again, thanks for taking some time to stretch and move a little bit. I think one of the first things that goes when we start experiencing pain is our loss of mobility. So keeping things warm and moving around, even when it hurts, can be a good idea, but don't push it too hard. Of course, do what's recommended by your doctor and your physical therapist. And I'll see you in the next one.